Thank you for tuning into The Art of Aging. We know your time is valuable. I'm your host, Sherry Gibson Walters, certified professional consultant on aging and founder of Harmony Caregiving, a family owned and operated home care agency right here in Edmonton, Alberta. Today, we're diving into a powerful topic: how the experiences we have early in life can shape how we age. You may have heard that things like exercise and diet influence aging, but what about childhood experiences? What about stress, trauma, or even the community you grew up in? Research now shows that past trauma can even increase the risk of dementia later in life. Today, we'll explore how things like our upbringing, money, education, and even our relationships play a huge role in how we age. And don't worry, we're keeping this simple with real life examples that show exactly how this plays out. Joining me today is Saskia Blessing, a social service worker and social work student about to graduate, who is currently doing research on aging and gerontological practice to help break it all down in a way that makes sense. Welcome, Saskia.
Thank you so much for having me, Sherry. I'm really looking forward to discussing this really important topic with you. For anyone listening in, I just want to make a note of caution that we will be discussing some topics of trauma that could be triggering or challenging for some. So please feel free to pause, take a break, reach out for help if you need it. This might bring up challenging emotions, and your safety is important. So I invite you to take care of yourself as you listen to it.
Thank you for sharing the importance of taking care of ourselves and each other. Before we dive into specific examples, let's take a step back and understand the big picture. Aging isn't just about genetics, it's about our entire life experience. Scientists have found that the conditions we live in, the opportunities we have, and all the stress we endure all play a role in how our bodies and brains function as we get older. So this is actually why two people who are the same age might experience aging very differently. One person may stay active and independent well into their 90s, while another might develop health issues or cognitive decline much earlier in their life. So the difference often isn't luck. It's shaped by factors like access to healthcare, social connections, nutrition, and even early life stress. That's where something called the social determinants of health come in. This is just a fancy term for major life factors that influence how we age, but let's break them down with some real life examples to make sense of how they work. Saskia, can you explain why two people of the same age might experience aging so differently?
So, for sure, everyone lives in different environments and has different access to resources like social support and healthcare. One study that helped me understand this on a different level was the famous twin studies that you might have heard of, where they
Mhm.
separated twins at birth and studied how the different environments they lived in shaped who they were. And so it's kind of taking it back to the whole nature versus nurture debate that we've heard about for so long. And this helps us understand that it's not just our genes and it's not just our nature that changes how we grow up or impacts who we are, but it's actually our environment and the things around us. This is called epigenetics as well, which is basically the study of how your behaviors and environment can change your genetics as you grow up. And that changes the way that we age. So the social determinants of health help us understand what parts of the environment can impact our genetics and ultimately our health.
Right, thank you. So, to understand this better, can you explain to our viewers what the term social determinants of health actually means?
Yeah, I mean, before you said it's a fancy term, I'll say the same thing. It kind of sounds technical, but it is really just a fancy way of saying what in your life made it easier or harder to stay healthy. How
Hmm.
can social influences determine your health? And so some examples of that are, like I said before, environment, our housing, food and nutrition, and income and work conditions.
Right. So, one of the key social determinants of health you mentioned is our neighborhood and built environment. The environment we live in affects our health in ways we might not even realize. So, what aspects can influence our health?
Really, all aspects of our environment. Let's take a moment and just think about where you're living. If you're listening to this right now, are you living in a home? Is it an apartment? Is it a house? Do you own it or do you rent it? What neighborhood is it in? What area of the city is it in? What infrastructure do you have near you? Hospitals, schools, grocery stores, parks. All of these things can affect your overall health and well-being. Access to safe housing, clean air, and walkable areas can promote a healthier lifestyle, while high crime areas or areas that you think are maybe less safe can negatively impact your health and community and your socioeconomic status as well.
Yeah, it is amazing actually how the things we don't even think about daily impact us. And my understanding is that these things don't just go away as we age. So, how does this impact aging?
I think what helps me understand this is really imagining how older adults actually live. And when you think of them in that environment space. So I'll give an example. One lives in a neighborhood with free access to parks, sidewalks, community spaces. They're encouraged to do physical activity and social interaction
Hmm.
just because walking out their door, they have access to those things. But the other person maybe doesn't have access to the same green space. Maybe there's a lot more heavy traffic, higher crime, so they don't feel safe
Hmm.
walking around. So that can really make it difficult to get outside and to be a part of the community. So over time, the first person is, more likely to stay active,
Hmm.
maintain their well-being, while the second probably has increased stress. They may experience more isolation
Hmm.
and ultimately have a higher risk of cognitive decline.
Yeah, I see what you mean. So, our past, present, and future environment can actually impact our health. I bet a lot of people don't think about that. So, do our relationships and sense of community play a role too?
Oh, absolutely. I mean, feeling connected to family, friends, support networks of any kind, that reduces stress in our lives, and that can help us live longer. If we kind of go back to those same older adults, one has that active social life because they have access to community. They spend
Mm-hmm.
time with family and volunteers, but another, they feel isolated. They don't have that same access. Maybe they live alone. Maybe they don't have family nearby. And one of the studies that we looked at is that loneliness and isolation increase the risk of premature death by 26%
Wow.
and 29%, respectively. So,
Wow.
loneliness is as harmful to health as smoking 15 cigarettes a day, is what that study said.
That's actually shocking, isn't it? But wow, it actually reminds me of the phrase "sitting is the new smoking," which warns us about the serious health risks of prolonged sitting. Just like smoking, too much sitting can increase the risk of heart disease, obesity, diabetes, and early death, even for people who exercise. I know some seniors who sit in their recliners for 16 hours a day watching TV and even sleep in them all night, right?
You're right. I mean, movement and social connection are both key to staying healthy. That's part of wellness. When people don't stay engaged, they're at a higher risk for cognitive decline, like I said before, which, you know, impacts your increased for dementia as well and other mental health challenges. And that can make grief even harder as well as we age.
Yeah, for sure it does. And that actually really hits home for me because I know someone very close to me who lost all of her siblings, like five of her siblings over the years, and just over the last 4 years. And so that's actually, she used to be the go-to person for her sister. And then after her sister passed away, this person actually lost all motivation to stay connected. She lives in an independent living condo, but there's lots of seniors around, and she used to be really active in that community. But now, many of the people that she relied on there or that actually relied on her have passed away. So she seems disconnected from who she used to be, and it's quite sad. She doesn't go up the stairs anymore for daily exercise. She doesn't want to shower. She rarely cooks for herself. And it's clear actually that her grief, these really deep seated grief and emotions, and loneliness are truly impacting her health.
Wow, that's a really powerful story. Thank you for sharing that.
Yeah.
It resonates with me because I can think of someone I know that's going through something similar. And, I just wonder how many people that are listening can think of someone facing those similar challenges and struggles.
Yeah. It is actually a really powerful thought. So, what can we do to actually help? What are some ways to support people who are feeling isolated?
I think that's a really good question, and I think it really depends on the person. But, think about ways that you can engage in social interaction. So it
Mm,
might be going to a local senior center, maybe engaging in a hobby that you really love or that you've
yeah.
given up many years ago. You can go and join a class or join a group. And, sometimes fighting that isolation doesn't have to always be around other people. Sometimes just going outside and being around community members can start to
Hmm.
shift your environment and shift the way you feel. And that shifts that isolation. It also might motivate you to engage in some more of those social interactions. And sometimes it just takes those baby steps to be able to get us to move forward and move beyond being inside and stuck by ourselves all the time.
Yeah, I always feel better, no matter what. It's always fighting that whole thing about let's go for a walk, and you literally always feel so much better, and you're so glad that you did it. But it takes almost everything you can to get out there. So
Yeah.
yeah, thank you for the reminders of like those little things that we can do to just prevent that isolation. And I think COVID actually did a really big number on people as well, and especially seniors, right? So, being able to encourage those things now that COVID is over. And I think there's still like the remnants of that, right? Impacting people in such a huge way,
Absolutely.
and especially the seniors.
Yeah, yeah, absolutely. There's a fear of going out and getting sick and being around other people. COVID really instilled that in a lot of people, and understandably in many ways, but there's so much health that comes from that too. So we have to
Yeah.
remember that.
Yeah, that's absolutely
Yeah.
true, right? And it actually shone the spotlight on a lot of people that needed the spotlight shone on them. So there's the ups and downs to everything. That's the way we kind of look at things at Harmony Caregiving, right? There's always the ups and downs, and it's like looking for the light in every situation if we can, right? So, another key social determinant of health is consistent access to nutritious food, right? A diet rich in fruits, vegetables, and whole foods supports brain function and overall well being. While poor nutrition can contribute to chronic diseases and cognitive decline. Have you seen this in your practice, Saskia? Like, have you experienced that or seen that?
Yeah, it's actually really funny you say this because I just saw a post on Harmony Caregiving's Instagram about this today. So
Oh,
you guys
interesting.
you're right on track. But if I think about an older adult, even a client here at Harmony, you can think of someone that has access to fresh, healthy food. They
Mm,
follow a balanced diet, and maybe that's part of their lifestyle. That's always been part of their lifestyle, so it's easy to incorporate later in life. And maybe other people don't have the same access, or it's just not something that they're used to. There could be financial constraints. They might not have the same food availability. And so over time, the person who has that access to healthy food, they get the vitamins and the nutrients that they need for their brain to be healthy. The second person has a higher risk of developing diseases like diabetes,
mm,
high blood
mhm.
pressure, and that can impact our cognitive health as well, and lead to dementia. So, eating well is truly one of the best ways to protect our long-term brain function. But not everyone has equal access
Mm,
to healthy food.
yeah.
And that's really what makes the social determinants of health so important, is it recognizes that equal access isn't there for everyone.
Yeah, no, absolutely. And thank you for sharing that example. It really does make me realize why these social determinants of health are so important to talk about. Not everyone has an equal opportunity to maintain their health and their age and actually age well, right? So one of the other things I'd like to talk about is like work conditions and stress levels. Work conditions and stress levels are another social determinant of health that can have lasting effects on the aging process. Safe working conditions, job security, and work life balance contribute to well being, while high stress and unsafe environments can negatively affect brain function. What do you think about that, Saskia?
Yeah, I think it's super important to address. I mean, think of how many people you know that may have had to take a stress leave at some point. That
Uh-huh.
really impacts your health. And so your work conditions contribute to that, but so does your income.
Huh?
If you're on a lower socioeconomic status level, then that causes stress inherently, right? You're not
Uh-huh.
having the same access as other people to things you need.
Yeah.
And so, for example, again, if we kind of think of two individuals who spent their careers in completely different environments, one worked in a supportive job, everyone around them helped support their stress, manage their stress levels. It
Mm-hmm.
allowed for time off and a healthy work-life balance. But another person maybe worked in a really high pressure job with really long hours and constant stress. And, the second person has that prolonged exposure to stress hormones like cortisol, as we know as the stress hormone,
Oh,
and that can damage brain cells over time, which is kind of scary when we think about how that increases our risk of memory loss and dementia. So managing work-related stress is key to aging healthily.
yeah, I think that's a very important point. And so what you're saying is that like even we as employers have a responsibility in reducing stress, and that in turn helps prevent dementia amongst many other diseases and illnesses that come from that increased cortisol level and stress.
Absolutely.
So If you or a loved one could benefit from support tailored to the whole person, connect with Harmony Caregiving, where we walk this journey with you. We offer care that addresses the body, mind, and spirit, ensuring a balanced and compassionate approach to aging and well-being. Or as Saskia would say, we offer a gerontological approach to caring for people. Thank you, Saskia.
Right.
Thank you all for tuning in to The Art of Aging. If you found this episode helpful, please share it with others who might benefit. And remember, you don't have to walk this journey alone. Keep embracing the art of aging with grace and vitality. Saskia, together, our care values, carpe diem,
Carpe
seize the
diem.
day. All right. Thank you so much for joining us. Have a wonderful day with grace and vitality.
Thank you so much, Sherry.
Thank you, Saskia. Take care.
You too.